Hi, everyone. I'm Dr. Diane Hayden. I am the publisher of Natural Nutmeg Magazine and Essential Naples Magazine, and I'm excited for you all to be with me today on the path to healing conversations with our expert practitioners that we host once a month. We're talking today about Lyme disease, and I'm excited about that because it is a very tricky disease with a lot of different facets to it that we're going to be talking about today. And I'm excited to have three experts on the call with me that all treat and work with patients with Lyme disease in kind of like three different arenas. So that's going to be exciting. So let me introduce them to you. I have with me today Dr. Pamela Cipriano. She is a doctorally prepared nurse practitioner and the CEO and founder of the Practice of Health and Wellness in Thomaston, Connecticut. She is the first nurse practitioner to open a solo practice in Connecticut, and she is nationally recognized expert in the diagnosis and treatment of Lyme disease, co-infections, mold-related illness, and heavy metal toxicity. Her path into complex chronic illness began after her own son experienced a delayed diagnosis of Lyme disease, and her research revealed that environmental toxins, mold exposure, and heavy metal accumulation were often underlying contributors and frequently overlooked. She now uses advanced functional testing and develops personalized treatment plans that incorporate IV therapy, detox, antimicrobial support, and lifestyle medicine. And you can find her at www.thepracticeofhealthandwellness.com. Next, I have Jackie O'Keefe. She is the founder of Aura Light Therapy, which is in Farmington, Connecticut. And that is a space born from her desire to create a healthier, more balanced lifestyle for herself and her family. After leaving an overly demanding and toxic workplace in the wine and liquor industry, Jackie flipped her focus toward promoting a healthier lifestyle and helping others feel their best through red light therapy. Her journey inspires her commitment to providing a welcoming and supportive environment for healing and growth, and her website is www.auralighttherapy.com. And Dr. Adam Briner. He has dedicated over 2 decades to advancing naturopathic care through innovative techniques and technologies. With a focus on cutting edge approaches like hyperbaric oxygen therapy and EEG neurofeedback, Dr. Briner has become a trusted figure in the realm of neurological health, Lyme disease, and other chronic illnesses. Balancing modern techniques with a foundation in energy medicine, his dedication to natural healing is evident in his practice, Whole Body Medicine, situated within the Briner Whole Body Health Center in Fairfield, Connecticut. And his website is www.wholebodymed.com. So I'm going to ask Jackie and Dr. Pam and Dr. Adam to just put their contact information in the chat when they get a chance. However, you want our listeners to be able to contact you today, website, email, phone, anything that you want to give them, that would be great. And I'm going to ask each of you to just say a couple words about your practice in general, and then we're going to get right into the questions. So, Jackie, I'll start with you. Just tell us a little bit more about your practice in Farmington.
Sure. We've been in business just about 2 years. We do red light therapy, and red light therapy is all we do. We are using a medical grade device, meaning we're using the maximum amount of light energy that we can to help people feel better. So I would say probably the first question we get is, what is red light therapy? Simply, it's just an energy source that we're able to harness to help people to essentially repair. Our bodies have every mechanism that they need to help us battle many different ailments. But red light therapy just offers us that energy to help fuel the cells, to help us really feel our best. We started our practice with helping people to manage weight gain and help them to lose weight. Over time, we found that people were really just starting to feel better overall, better sleep, less stress, less pain. I mean, so many benefits. So it's really fantastic treatment. And I am so happy to be here to be speaking about this topic today. So very exciting. Thanks for having me.
Yeah, thank you, Jackie. You have a beautiful space in Farmington. People need to go check you out
Thank
over
you.
there for sure. Yeah, it's awesome. Dr. Pamela, tell us a little bit about you and your practice.
Thank you so much. So I'm Dr. Pamela Cipriano. I'm a nurse practitioner with my doctoral degree. My practice is functional medicine, so it's both allopathic and naturopathic. I do a lot of different types of testing for not only tick-borne diseases, all tick-borne diseases, but also DNA testing to see what genes might be turned on and what supplements may be able to help you to get them more regulated. We have moles. We use Mosaic Labs for mold toxicity. Heavy metal poisoning, we use doctor's data. And then in the office, we, for specifically for Lyme and co-infections, in addition to antibiotics and all natural antimicrobials, we also do IV infusions with IV vitamins, specifically vitamin C for Lyme disease and other vitamins to help boost the immune system. We have infrared sauna with far rays and red light therapy. And we have halotherapy as well to help to boost the immune system and decrease the positive ions in the body. So that's what we
Awesome.
do at my office. Thank you.
Yeah, yeah, that's fantastic. And Dr. Adam, tell us a little about you and your practice.
Well, our practice is the first integrated dental and naturopathic practice in the country that I know of. So we have been fusing a lot with, just looking at the whole body, top down. So we get a lot of chronic disease states, and of course that includes Lyme disease. I've been treating that for over 20 years, with everything from looking at it from the energetic perspective, also some of the, more cutting edge uses, things like true hyperbaric oxygen therapy. We also have IV therapies at the clinic, and many, many other things. So I focus a lot on the brain, but, just difficult to treat cases. And Lyme is obviously one of the things that a lot of people deal with, and they may not know they deal with it. And sometimes even the labs aren't good at picking it up. So we have some other ways of, testing besides, the labs. But there's a lot to go through, so I'm not going to keep going on and on. But that's a little bit about us.
Awesome. Thank you so much. And yeah, this is really a complicated subject for sure. And by no means do I think we're going to tackle it in an hour or 50 minutes at this point. But my purpose for this was really just to do something live, like we do with all of our Path to Healings, and to let people get on live and have an opportunity to ask questions if they want to, and really just try to tackle some of the basics of it, and then maybe some of the newer styles of treatment that you three are doing, and just to open up people's minds as to a lot of different things that are out there to help with this really challenging illness for sure. So that being said, the first question I'm going to ask, and I'm just going to throw some questions out to the three of you. Guys can just jump in and talk when you want, or I might be asking one of you specifically something related to what you do in your practice. But I think this is a general question that that most people are curious about. A lot of times, we think when we've heard about Lyme for I don't know how long, it's always been like, oh, there's a bullseye rash, you'll see something. But a lot of times, I mean, this is more common knowledge, most people are not even aware that they have a tick bite. And so if you don't have that classic bullseye rash, are there symptoms? Like, how would someone even know what they're presenting with to, especially if they're going to a conventional doctor who's not going to ask those kinds of questions? What are the symptoms? Are there symptoms that people should be looking for that might be something to either lead them towards seeing someone like, a practitioner like one of you, or just to know, oh, wow, maybe I should ask the doctor I'm going to investigate Lyme because, that might be what this is.
So I'd be happy to start with that because I have a lot of patients like this. So Lyme disease is the only bacteria that's going to cause the bullseye rash. The problem is one tick can carry up to 14 different diseases. None of the other diseases are going to cause the rash. So having the summer flu is usually one of the first triggers that that you have more of an acute phase of some type of a tick-borne disease, where you have the high fever, exhaustion, body aches, things like that. The flu generally doesn't go past April in this part of the country. So if you're in the middle of summer and you suddenly develop those types of symptoms, you really should be tested for tick-borne diseases. Now, having said that, local testing is really poor. So the possibility that you'll get a false negative is very high. So my recommendation is if you feel as though, you were in an area where you had ticks in the area, because most people don't even see the tick, never mind see a bullseye rash. But if you went hiking, even if you're at the beach with your friends and they're sand fleas. All of these things can carry some type of a disease burden, not necessarily Lyme disease, but Bartonella, babesiosis, ehrlichiosis, anaplasma, brucella, tularemia, Q fever, Rocky Mountain spotted fever. There's so many different things that one tick can carry. Anytime you have symptoms that are outside the ordinary for the months that we're really in the summer months, I would definitely find a provider. I usually recommend going through ILADS, International Lyme and Associated Disease Society, because we're all trained on specifically for tick-borne diseases. So that's what I would recommend.
Okay, that's great.
Yeah, I think the thing that people may not think of is they may have been sick like that at one point, but then it resolves. And then years later, they get hit with something else. And that's when the infections start coming out. Because, our bodies are meant to fight infections, our bodies are meant to, heal themselves, but they don't always. And I think that's important because these chronic disease states, things like MS, things like neuropsychological diseases, they can all be tick-borne related or have part of that being part of the picture. And that often gets overlooked. And like, Dr. Pam was saying, there's just so many vectors. I mean, mosquitoes are a vector of many infectious diseases. And yes, they can carry the Borrelia spirochete. So we just don't know. You may not get the quote unquote rash, even when you get bitten. Some people actually see the tick bites. And in this time of year, especially with the little nymphs, like the very small baby ticks, people may not notice them that they got bit. So we really just it's called the great imitator for a reason. Borrelia burgdorferi, the Lyme disease, because it really can mask itself as so many things. So the typical fever, sore throat. Yes, it could be like that. Achy joints, Bell's palsy, right? All these can be related to Lyme, but so many other things can as well. So if it's not being resolved or not being thought of by your doctors or practitioners, and you're not getting better, there may be a reason for that.
Mm-hmm. Okay, great. So I think that I've also heard that sometimes people get sicker before they get better with Lyme. Like they actually start getting treatment and then they start feeling worse. Have you found that to be the case in
Yeah.
some of your patients? And maybe just what is your thought on that? Like, why do you think that happens?
I could just start off and then everyone else can jump in. It's people know it as the Herx or Jerix-Herxheimer reaction. And it's like you're blowing these bugs up with whatever therapy you're being used. And that metabolic waste is in the bloodstream. Your body has to deal with it. So you get an amplification of symptoms. Um, and I always say an amplification of symptoms, not just your typical flu-like type of Herxheimer reaction. People would call it Herx for short, because it could just be whatever symptoms you're having that could actually get amplified. And that's also a sign. And I think for us as clinicians, sometimes that is a sign that we were on with our target, with our therapy. In other words, it, Lyme is a diagnosis of, it's a clinical diagnosis. So even if labs sometimes don't always match up, sometimes you treat based on what's presenting. And then if you treat them, and you sometimes see that Herx or you see the symptoms improving maybe, then you have then okay, you're on the right track.
So with the Herxheimer reaction, if I can jump in too, there was a researcher at the 2019 ILADS conference that did an amazing job. She actually injected Lyme disease into a mouse, and then she put a microscopic camera inside the vein of the mouse and gave an IV antibiotic. As the IV antibiotic was approaching the bacteria, the spirochetes, little corkscrew-shaped bacteria, started rolling up into little balls. And in that position, it's called a cyst formation, L form, or round body. The antibiotic is not able to attach to the receptors that are on the belly of the bacteria. She gave the mouse an it was a supplement, it was a substance to prevent the round body formation. I don't remember if it was monolaurin that she used. But put the microscopic camera back inside the vein of the mouse, and now all there were sticks. So they weren't able to move at all. They weren't able to change their shape at all. Then she gave the antibiotic again. And as the antibiotic attached to the receptors, unlike other bacteria that implode, so they kind of die in on itself. The macrophages from the body come out and gobble them up, goes into the lymphatic system, and then we expel them either through our urine or our stool. These blew up. Each one blew up individually. That explained a lot. It was a great research. It really was, just to see something like that. But to see the die off and why people get so much sicker was just an amazing research to watch. So I always tell my patients, if you're getting better or you're getting worse, we're on the right track. If there's no change, we need to start changing up the antibiotics, start changing up the supplements to try and figure out what are we missing. So that's usually why people end up getting worse. That was like the best. That was really the best. And it was unfortunately, she was the last speaker on the last day. She should have been the first speaker on the first day. I just felt
Yeah.
like it was such a great research that she did.
Yeah, that's a great visual for sure. And I think
It really
that would
was.
help people, right? Like, okay,
Exactly.
now I can see what's happening. Now this makes sense to me. I may still feel crappy, but at
Exactly.
least, yeah, because I think a lot of people get really frustrated with that. There's got to be a huge emotional component to this.
And
That
when you
like,
get, yeah, if you get sicker, who wants to get sicker? There was a researcher that actually he was an oncologist until he ended up with Lyme disease and ended up having to have a heart transplant. And when he recovered, he actually went back into business for Lyme disease and no longer for oncology because he felt like there was there's such a difficult time finding the right doctor for Lyme disease. There's just not enough doctors that are trained, to be honest. And he described it as cancer. Like you're gonna get worse, just like you would with cancer, but at the end you're gonna get better. So it does take some time. And unfortunately, with tick-borne disease, a lot of times it takes a lot longer than it would with chemotherapy for cancer. It takes a lot longer to get rid of a lot of the bacteria because sometimes you're not only dealing with Lyme, you're dealing with 3, 4, 5 different bacteria at the same time.
right.
And viruses
And viruses and parasites.
and
Yeah.
parasites.
Yeah, it's a lot. It's a lot. So I want to get into some of the unique therapies that you guys are working with. Jackie, let's start with you because you are a Lyme patient. I don't know if you want to talk a little bit about just your experience and the emotional component, and then you can talk about how you found red light therapy to be effective for it.
Yeah, awesome. Thank you. So, it was about 10 years ago, I was actually diagnosed with Lyme. Really kind of hit me by surprise. I don't remember getting the bullseye rash. I just, really remember heading in for my regular, physical exam with my PCP and just complaining about a bunch of symptoms. I had sore joints. I was getting headaches. I had sleeplessness. I've always had a ringing in my ear, but by that time, the tinnitus had really become almost unbearable. And I just wasn't feeling good. I wasn't feeling myself. I kind of just lost that passion. At the time, I just kind of chalked it up to it's probably just stress, right? I was a mom. I had 2 young kids in school, working a full-time job in sales. I mean, stress, 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 right? So, but my doctor's putting all the pieces together and thought, maybe we should test for Lyme. So it came back positive, and I was just kind of shocked, really, and very uncomfortable with the diagnosis. I didn't really understand much about Lyme in general, and even more surprised that my PCP didn't have a lot of information for me. Um, I was having a hard time understanding, okay, so I've got this going on. I'm going to take this antibiotic and then it's gone, right? And the answer was, well, no, it's not really gone, but it's kind of gone. And I just really left with more questions than answers. So I just kind of ignored it for many years. And then at one point, I'm just kind of feeling like that same crummy self that I was years prior. And I was fortunate enough to run into a specialist who deals with Lyme. She's a functional medicine doctor. And she explained that based on my symptoms, I was likely having a flare up. Never heard of that before, didn't know it was possible. So, what do we do from here? And it didn't seem more antibiotic, but red therapy practice, and my research red light therapy could be very helpful for managing the symptoms. So I began my journey with treating myself on a daily basis, red light therapy, and was very pleasantly surprised, if you will, that a lot of those symptoms I was dealing with were starting to dissipate. The one most noticeable thing was the achy joints. I've always had, the achy joints in my knees. My sleep was improving.
Oops, we lost her. All right. Hopefully she comes back. So that was fascinating. Um, do either of you, Pam or Adam, do either of you guys do red light therapy in your practice?
My infrared sauna has red light therapy in it. So people
Okay.
are in there for anywhere between 20 and 60 minutes at a
Yep.
temperature of either 120 up to 150. So it depends on where they are on the spectrum as far as Lyme disease goes. If they're brand new, I try and get them to just go in for 20 minutes at maybe 120 degrees just to see how they're going to feel with it. Because the heat alone, the infrared and the red light can actually kill off the bacteria, causing a Herxheimer reaction. So that's something I'm trying to avoid.
Yeah.
Yeah, we've used infrared sauna for many years, but we also use photobiomodulation with laser, which we found very effective depending what we're using, and where we're using it, and also the photobiomodulation in the blood. So you can actually do that as well. So light is a great carrier of information, the infrared specifically, it really actually helps you detox too, which is we didn't touch on that yet, but detoxification is a huge, huge thing. So I think sometimes the people go in, um, and and you could also speak to this, Pam, about the people who are Lyme tend to have hypothyroid. It's almost
Mm-hmm.
like the bacteria is like, oh, this is smart. We don't want a fever because we want to be able to survive. So it turns down the thermostat. So your body temperature tends to be lower. And what do you do to get better? Is you get a fever, you heat up, and so by using things like sauna, you're able to artificially give yourself a fever to help yourself fight the infection.
That's a great way to put it.
Yeah, that's fascinating. So, tell us what other cutting edge new therapies that you guys have found that are being effective now.
So I can't say I have any cutting edge things that I'm using here. I mean, I use the infrared, I use the red light, I use the halotherapy. They all really boost the immune system. They help to decrease inflammation, they help to detox the body. But really affecting the detox pathways, as Adam was saying earlier, is probably the most important thing we can do. So aside from the testing, I do a lot of chelation therapy for patients who have heavy metal poisoning, which a lot of times they don't even realize it. But if you're somebody who's had a number of CAT scans with contrast or MRIs with contrast, you're going to have heavy metal poisoning. I've had patients with uranium in their
Mm.
bloodstream that is, I mean, so elevated. Lead, plutonium. I mean, the things that I see are absolutely frightening. And the thing is when we are prescribing, or we're ordering an MRI with contrast or a CAT scan with contrast, we don't know what is in this contrast medium. We have no idea what we're actually putting in our patients. And it's when somebody who's had a number of these tests done comes in with, usually it's like a neuropathy or radiculopathy, like a burning sensation or numbness and tingling, literally from their head down to their toes. It's usually a clear indication for me that they most likely have heavy metal poisoning. So that's when I'll do that type of test. The Intellix DNA, to me, that's more of a cutting edge type of thing. It tests your DNA for genes that are not balanced. And the way the program works is it not only identifies the genes, but it also gives you suggestions on what supplements, what foods, sometimes medications can actually revert that gene back to normal. So I have two patients right now. One is 25 and one is 14. And I started antibiotics on both of them for Lyme disease. And they both started with seizures after the antibiotics were started, which
Wow.
was really frightening for me because
Yeah.
that's something I hadn't seen yet. And it's in the literature. There's other doctors who have seen this. I just have never seen this before. And so my one patient, not only did he have a grand mal seizure, he went into status epilepticus, which is the seizure will not stop. Like it's one continuous seizure. So they had to, put him on life support, life started him out to Hartford Hospital. Um, they had him on an Ativan drip. Nothing was stopping these seizures, which was absolutely frightening. And so when he was released and came back to the office, I did a Cunningham panel on him to see what inflammatory process is going on in the brain, which frighteningly, the neurologists don't know what the Cunningham panel is. They don't know much about anti-inflammatory encephalopathy, which is what he has. It's like an autoimmune seizure disorder because he was on an anti-seizure medication and still having seizures. So then they added another anti-seizure med, but he's still having seizures. And so I'm not a neurologist. I'm trying to figure out why is my patient still having seizures when he's never had a seizure in his life. It didn't start until after he started antibiotics for Lyme disease. Um, and it was because it was an autoimmune problem. But when I spoke with the neurologists about this, they, I mean, they never heard of this before. They didn't know how to treat this. But in the literature, it shows that if you have a patient who is having seizures and the anti-epileptics are not working, it's not because they have an epileptic problem. It's because they have inflammation in the brain causing this. And so it was a lot of supplements we had to start. He's going to be coming in the office next week, starting IV methylprednisolone to try and decrease the inflammation in the brain. We're going to be doing that for 5 days, 1,000 mg for 5 days, going on a prednisone taper, like everything to try and decrease the inflammation in the brain. But that was probably one of the most frightening things I've had to experience with a patient.
Yeah.
Well, yeah, so many neurological conditions are due to encephalopathy, encephalitis due to some kind of toxin or infection or combination thereof. So I think what we have to think about, what you have is you have layers. You have that layer of toxicity that they've been exposed to over time, whether it be from MRI, like gadolinium, or other things, or in the environment. We have so much toxicity in our environment, right? And we're just trying to start getting rid of some of these from the food supply, et cetera. But there's still so much. So what happens is that our body, it's like everyone's got different um, like sizes of their buckets, right? And that's part of your genetics, your ability to deal with those toxins. So as people keep adding and adding and adding to that bucket, it'll eventually overflow. And then we start running into a cascade of problems. And you end up with this sort of, besides the toxicities, which we have to deal with, right? Whether it's orally, through herbs or homeopathics or IV through different types of chelation. You have to bring those toxins down and you have to deal with the inflammatory state in the body. So one of the things we've been using over the past year, a little over a year now, has been something called True-Dose PRP. And what that does is that uses your body's own um, platelets in a way, giving back to you at the right dosage. And that's pretty amazing because it's your body's own healing properties, and your body goes through inflammation and it resolves inflammation normally. But when something else keeps you from doing that, you have to do it kind of like a reset. I call it like a Control Alt Delete. And when you do that reset, the body can then boot through and reset its inflammatory process. So that has been super helpful for people with Lyme and a whole host of other conditions. But you still have to work on the bacteria and you still have to work on detox. So there's not just one magic bullet, but helping your body heal in some way that it heals itself. That's always the best.
So that's fascinating. So basically, PRP stands for platelet-rich plasma, right?
Correct. Yeah.
And yeah, okay. So you're taking blood from the patient and sort of cleaning it.
You're not really cleaning it. That's like a plasmapheresis where you're cleaning a person's blood. But what you're
Okay.
doing is you are removing the red blood cells and you're removing, most of the plasma. So you're just left with really very high concentration of platelets. And
Okay.
that's given back to the patient. And you would say, well, wait a minute, you're just taking the blood out and you're putting it back in. Like, how's that do
Right.
anything?
Yeah.
It doesn't really, but there's a lot to it. The platelets do more than what people think is just clotting. They actually
Okay.
do a lot of things. And they're a part of your initial immune response. But they're also part of the inflammatory process, right? You get a cut, and what has to happen? One of the first things that go there are the platelets. And those platelets have to start telling all the other cells to come here and start healing. And what's one of the things you get when you get a cut? Well, it starts getting inflamed. So it's part of the inflammatory process. But sometimes our body gets caught in this loop, right? This danger response, cell danger response, and it doesn't stop. And that's when we run into problems. So that's how this seems to be really helping the body resolve that state itself and helping the immune system to start seeing these bacteria and viruses a little bit better.
Hmm. So the other thing I was going to ask about, I don't know if either of you use this in your practice, and if you don't, and so you don't feel comfortable speaking to it, that's totally fine. But I just came across it when I was doing my own research about like what are new cutting edge things out there, and I hadn't heard of this being used. But one of the things I saw was regenerative therapies like stem cells being used to treat Lyme disease. So is that something either of you want to speak to, or?
I would say that stem cells, I'm very familiar with them. We've had patients get stem cells. I've had it at different parts. There are autologous stem cells, right? Fat stem cells, bone marrow stem cells. And then there are other types of stem cells you can get, mostly out of the country because of the legalities here. And they can be very helpful because of that inflammatory state and helping it. But it seems that you'd want to do more work kind of against the inflammation and the infections before you run into stem cells, specifically for Lyme and like traumatic brain injuries and stuff. There's be that like a whole other subject. But when we're talking about infectious disease, you have all these great, beautiful, fresh stem cells, and it's like you're giving the infection something new to feed on. So it may
Oh,
not be the
interesting.
right, yeah, you may not be the right time. It's all about timing. Stem cells can definitely help, but I think it's about timing. I mean, Pam, you could talk about it too, Dr. Pam.
Yeah, no, I completely agree with you. Stem cells for me is more like a patient who has Lyme arthritis. Usually, it's almost always affects the knee for some reason. If it actually started to degrade the knee, the cartilage, and things like that, you can use the stem cells to help to rebuild that. When you are doing the true dose, there is some stem cells that are part of the PRP and the PRF. So in my office, I don't have true dose. I will spin down and get a PRP and then inject it into a patient, depending on what's bothering them the most. And I don't know if true dose has the ability to sustain the stem cells to be able to correct some other parts of the body. So the stem cells that I've seen so far, it's more injecting into a specific joint at this point, is what I've been saying. And I don't know if it's just something I haven't heard of. Um, but like I said, when it's given, when you're spinning down the plasma and you're left with the the platelets, sometimes those will have stem cells in it,
You'll
which
get
may
something
help to.
called V cells, like these little small cells. But when
Yeah,
we're talking, what I think what Diane's mentioning are things like uh, uh, mesenchymal stem cells or even fetal stem cells given
yeah,
intravenously. So you're getting a systemic effect. And yes, you can
yeah,
inject things directly, but yeah, so stem cells can be very good. I think
yes.
it depends on where and when.
Right.
Yeah.
Yep. Yep. So why is it that some people develop more long-term, you know, issues with Lyme, and other people seem to just be able to go through, the process. I'm not saying it's short, but it could take 6 months to a year or more. But then you hear about other people who have symptoms for years and years and years. Like I guess that's what we would refer to as chronic Lyme, right? Do you know, like, is there like a genetic component to this, or is there something related to that particular person, maybe stress level, like or is it, or we just don't know why that happens?
So for the patients I've seen, it's usually they from what I've seen, they went to their doctor, they knew it, they had a tick bite or they had a bullseye rash or something like that. And they didn't get first of all, they weren't tested properly to see exactly what disease did they have. They assumed it was Lyme disease, but they didn't know if they also had Bartonella, Babesia, or any of the other tick-borne diseases. So sometimes it's partial treatment. Sometimes it's the treatment is just too short. So the 2-dose doxycycline, why it's still on the CDC site, I honestly have no idea. I know I've written into the CDC. I know a lot of other doctors have written into the CDC. It's an antiquated study from 1990 before we knew that not everybody gets a bullseye rash. Between 20 and 50% of people get the bullseye rash. The research was based on the bullseye rash. So if the person took the 2 doses of doxycycline, they didn't get the bullseye rash, then that worked. Well, we know that's false. But because it's on the CDC website, many people go to urgent care, emergency department, or their primary care, and they get 2 doses of doxycycline, telling them that that's all they're going to need. Well, now you've just set this person up for chronic Lyme disease down the road. So you might have your symptoms now. Sometimes you don't have symptoms. My son was treated with 10 days worth of not doxycycline because he was only 6 years old. So he must have gotten like cefuroxime or something like that, cephalexin. It wasn't a long enough period of time. So 13 years later, when he had hernia surgery, that was his trigger. 'Cause there's always a trigger when you have something chronic like this that drops your immune system. The bacteria take over when your immune system drops. And so that's what happened with him. It was after the surgery that all his symptoms came about, and it was that chronic Lyme type of symptom. The only reason I know that it was from that same tick bite when he was 6 years old was the surgery was stopped in the middle of it, and the surgeon came out to talk to me because my 19-year-old son, his entire abdominal wall looked like Swiss cheese. There were so many holes in it for no reason whatsoever. And so at the time, I didn't know anything about Lyme disease. I knew about as much as most mainstream doctors know, which isn't much at all. And so when he's asking me these questions, I had no reason to know why my son's abdominal wall looked like that. He called the Connecticut Children's Medical Center, spoke with the surgeons there. They had no idea. He got in touch with Mass General. They had no idea. It wasn't after the surgery, about a week or two later, that all his symptoms started. It was a nightmare because we didn't know what was going on with him. So that's typically the person I see, where they got bit as either, a young child or their teenage years, and then something triggered their immune system to stop functioning properly, whether it was an illness, a death in the family, a car accident, something that just dropped their immune system. And that's when I see the chronic Lyme symptoms. So when I have a patient come in here and I do my first initial evaluation on them, and I rarely will get somebody who just got bit by a tick. I usually get a person who has surmised or they've done a lot of research on their own. They've turned into their own doctor to try and figure out what's going on with themselves, that they'll come to me. And it's always whether they remember getting bitten by a tick or not, they do remember having some kind of a trigger that just rocked their world, and that's when all their symptoms started. So back in the 90s is when they were calling it fibromyalgia, which I never agreed with that diagnosis because it's a diagnosis of exclusion. Everything else is negative, so you just labeled with this fibromyalgia, which just never made sense to me. Well, now I know it's because of a tick-borne disease, because your immune system was strong enough to try and keep everything where it is, even though the bacteria is growing and growing and growing, and using your connective tissue as energy and making their biofilms and kind of setting up housing. But once your immune system drops, all hell breaks loose. And so that's what I saw with my son, and that's what I see with the patients that come here. So that's a true indication that they've had this for a prolonged period of time, and it's not a new process, it's not a new disease.
Yeah, I agree. And I think also the biofilm, which you just mentioned, I think that's something that a lot of people don't know about, which basically is the bacteria go into hiding, right? It's like if you ever, when you wake up in the morning and you kind of like feel that filmy stuff on your teeth, that's a biofilm. Most bacteria make them. It wasn't until, I remember when Ava did this and Dr. McDonald, but it must have been at least 10 or 15 years ago that they found that the Lyme is making these biofilms, and which means they can hide out and they can evade the immune system. They can also evade the antibiotics. You can carpet bond them with doxycycline and it just actually makes more biofilm. So there's all this idea of, how much you treat, when do you treat, how do you attack the biofilm. So these are all the things the clinicians that understand what to do are trying to work on that at different times. And, you know, anything that takes down the immune system, like the toxicities that we kept mentioning, and any other infection, like Dr. Cipriano mentioned about, a car accident, a surgery, a an emotional takedown, whatever that might be. I remember years ago when I first was just starting practice, I had a patient who was ended up with there was like a lot of he went off to school and ended up having, so it was just an emotionally traumatic time, so to speak, but ended up with so much brain fog and anxiety and depression, and went through all these things that um, you know, he was going to the psychiatrist. He was in inpatient care, was given tons of neuropsych drugs. I mean, nothing was touching, and finally did ECT, electrocuted the brain basically to try and help this. And that didn't help. And he was like, well, can I do hyperbaric to help my brain, heal after the ECT? I'm like, sure. He come in, started doing that. And during some of the sessions started getting fever. And I was like, wait a minute. Well, you have a fever. And then I started thinking, wait a minute, have you ever gotten bitten by a tick? And, this was Lyme really wasn't talked about much back then, or fair few. I was like I think me and one other naturopath were the first at ILADS years and years ago. So I was already thinking about this, but it wasn't really taught to us in school, right, Dr. Pam?
Never.
They didn't talk about it. And I started going through, and lo and behold, hygienics lab was lit up. He had Lyme. It was completely overlooked, especially by Yale, who thinks they own Lyme because Dr. Bergdorfer came from them. And so he needed to get treated. And once he was starting getting treated, he started getting better, went back to those doctors, the psychiatrists and stuff. And he said, look, I didn't have, all these I had Lyme disease. And they just like, they didn't want to hear from it. It was really sad. But yeah, chronic Lyme's a real thing. And, and I think there are a lot of factors to keep it chronic, even people treating it right. It's like you have to keep that immune system strong, and you have to keep detoxing, and the genetics, right? Are there certain genes that are weak, so to speak, or have recessive traits that it may mean that you don't detoxify as well, or you don't process certain nutrients as well, and maybe for you need to fill those holes in so that you maintain a very strong system.
Awesome.
I think what you said is very important for people to hear, because it's not just antibiotics, it's not just natural antimicrobials, it's detoxing, it's raising the immune system, it's cleaning everything out in the body that is just inundated with die-off and inflammation. And I mean, it's a process to get better. And so, I've had people that don't want to go on antibiotics. I have a patient right now that was diagnosed with ALS. This poor woman is paralyzed from the neck down. She doesn't have the gene for ALS. She has two family members that had it. She does not have the gene. So it would be an atypical type of presentation, meaning there could be a reason why her body is reacting as if it's ALS. So if you have a family history of Parkinson's or ALS or Alzheimer's, you may have those traits because of a tick-borne disease, but it doesn't mean you have that specific disease. So for her, I don't know if she really has ALS. She has the symptoms of it. So when she first came to me, she was seeing a naturopath, and she was doing all of the all naturals, and she was progressing and progressing and progressing. And she said she didn't want to go on antibiotics. And I said, I mean, right now you are progressing so quickly. She got bit when she was a child. They didn't put her on antibiotics because she had no symptoms. She got bit when she was in 2023. She didn't go on antibiotics because she had no symptoms. In 2024, she developed foot drop. And now in 2025, she's in a wheelchair, paralyzed from the neck down. So it's very quickly progressing. So PICC line was placed. We started with the Rocephin, where I'm hoping that I started very slowly with her because the family was exceptionally worried about a Herxheimer reaction because they didn't know how it was going to react with her. So we started with 500 milligrams every other day and detoxing with glutathione in between. And then we went up to a gram. And now she's at the 2 grams right now. So, and that just started this week. So, she did have some symptoms, which was a really good sign for me. One of her eyelids was starting to droop during the 2 gram Rocephin infusion. So I said to her, that could be a sign, that could be the Herxheimer reaction for you. But you either want to get, like I said, better or worse. We're on the right path. If we don't have either one of those, we have to start changing up what's going on. But she has to, like, because she's new to me, I still have to test her for mold and I still have to test her for heavy metals. And because if you don't test for those things, you don't know. And if you don't treat for those things, you'll never get your patient better.
Dr. Pam, I'm so glad that earlier you mentioned about how, a lot of people, they get their diagnosis and then their doctors are giving them the 2 rounds of doxy. That was exactly my experience also. And it sounds like that's still what's very common today.
So common,
Um,
so common.
it's unfortunate. And it wasn't until years later where I got COVID-19 and recovered from that. But then, that's really where I got all the Lyme symptoms back, and it was magnified now. And around that time, that's when I learned it was the COVID that really kind of led to this flare up, which is just shocking to me. Now, we can't just, eliminate the possibility of future traumas and getting sick. It happens. But for someone like me, who I likely have chronic Lyme, and there's so many other people who may not even know it, what are things that we should be doing just to hopefully alleviate some of those potential symptoms if we are to experience a trauma or, major stressful event in our life or some other kind of an illness? I mean, we hear all the time, live a healthy lifestyle, exercise, eat well. Is there anything on top of that you suggest for people who have been diagnosed with Lyme, just
So
moving
diet,
forward?
diet is going to be the most important thing. I mean, diet is either going to make you really healthy or very sick. There's no in between with diet. In our country, we don't do a very good job of educating people the proper way to eat. We have more junk food in the grocery stores than we have fresh food. Everybody talks about organic vegetables and fruits, which is super important because of glyphosate and other things that can really destroy our body. But meat in general, I mean, if you're eating meat from a commercial farm, something you get at a grocery store, you're eating all those inflammatory markers. You're eating all of the garbage that these poor animals were fed. You're eating all the hormones and the antibiotics and things like that that are going to just continue to degrade our own immune system. So it's organic everywhere. Just organic as much as you possibly can. So now we have a healthy diet. So now we're trying to give the body everything that it needs. Now we need to detox. So I tell everybody that will listen to me, get on liposomal glutathione. I take it once or twice a day. We don't have a healthy enough diet in our country for our liver cells or hepatocytes to actually make glutathione. And that's what it's supposed to do. And that constantly detoxes and cleans out the liver. And if your liver is cleaned out and has great pathways, detox pathways, it's really hard not to completely get rid of a tick-borne disease or COVID as well. So these are two things that really will hang around in our body. And before I go further, it's so sad that we had COVID, which was around for what, 3 years? We know more about COVID than we know about Lyme disease when they're so similar. The amount of inflammation that both of them cause gives such similar presentations, but Lyme is just looked down upon in the medical community. I mean, I wish I had the ability to have a patient come in my office and I look at them and say, "Oh my God, you don't have Lyme disease. Oh my God, you don't have Bartonella." I wish I had that ability because I don't. I look at a patient, I have to start from scratch. I have to get blood work. I have to I have to figure out, when did you get bit? How did it happen? Do you remember getting bit? Our country is backwards right now, completely backwards. And it's very unfortunate that a lot of other doctors don't stand up to City Hall and make more of a fuss like the three of us are. I mean, I think if you don't make the fuss, you're not going to really help anybody else. So now we have the healthy diet, we have the detoxing, and everything else is really just trying to keep your body healthy. So, as much as you can to decrease inflammation in your body is going to be the best way to keep yourself healthy. So a lot of COVID patients will come here with long COVID. Their diet is god awful. They think they're eating healthy. They're having a muffin in the morning. Trust me, I like muffins too. But I know if I eat one, I'm going to be I'm going to have joint pain. I'm going to get bloated. It just reacts to me so differently. It's really, if you can't pick it, don't eat it. If you have to actually put more than 10 ingredients into something to eat, don't even bother. Like, look at the back of packages. Try and eat as wholesome as possible. I always use the analogy, if you had a really expensive car and it had to use a specific type of gas, but you were just, a little short on money, you wanted to put something, less expensive in the gas department, the car's still going to run. It's not going to run as long as it would. The engine's going to start knocking. You're going to end up with, having to replace the motor. It's a car. We treat our cars better than we treat our bodies. We have one body. We can replace a car tomorrow. So I just feel like we really have to take ownership on our own person and try and feed it as healthy as possible. And for me, every morning I get up, I work out, I drink at least 60 ounces of water every single day. I have the anything that is going to help me to stay healthy, because I've had a number of health problems myself that I don't even want to get into, but a number of health problems. I mean, I'll be 62 next month. I'm healthier now than I was when I was younger because I didn't know the things that I know now. So I think it's really important to really, do a deep dive. And unfortunately, you really have to be your own doctor nowadays, because if you just follow what your medical provider is telling you, and heaven knows where they're getting their information from, you're just not going to be better.
Yeah. It is pretty amazing what people are willing to spend their money on, but then they complain about organic food. It's like,
It
come
is,
on,
yeah, it's so
come
true.
on.
It's so true.
Hey,
And
Jackie, I'm glad that you popped back on again. I wanted to give you an
So sorry.
opportunity. No, no, no. This stuff happens, but I wanted to get back to you about the red light therapy because I know that has made a huge difference for you with some of your symptoms. And then there's one other question I want to ask about frequency therapies, but yeah, just finish what you were saying about just how that's
Sure.
helped you.
Of course, thank you. So the big thing with red light therapy is, like I was saying earlier, it is an energy source, and it really works by improving the energy in all the mitochondria, so in all of our cells. So we're essentially just infusing our bodies with this really good energy. Really, we have all the mechanisms within us to heal. That's our immune system, right? Sometimes we're just kind of lacking, the energy to really do so. So what we use red light therapy for is to help, of course, boost that immune system, but also to relieve the body of inflammation. So, like we've all been talking, it's about inflammation, right? That's what causes pain, a lot of discomfort. It was time to detoxify the body. For my own journey, I was using red light therapy on my system, on my body, after having COVID-19 and having that terrible flare up with Lyme. And I noticed really after only just a couple of sessions that all of my aches and pains were gone. The brain fog was starting to minimize, and I was really starting to feel like myself and getting a lot of that energy back. I also have some hearing loss, and I noticed that the ringing in my ear was starting to dissipate, which was also a huge relief. So now we do see a lot of people in my practice who do have Lyme disease and other chronic issues. And I want to make it clear, red light therapy is not a cure for Lyme, and we'll never claim it's a cure for any other autoimmune or anything similar. But it certainly does help quite a bit with these symptoms. And sometimes it can happen as quickly as just 20 minutes during a treatment. So it's been very impactful for me. I kind of practiced on myself, if you will,
Of
when I
course.
wasn't feeling so great. And so I'm very fortunate to have that. But now very happy to share our service with a lot of other people who are dealing with something similar.
Yeah, I think what's important to take from that is that when we were talking about how a lot of people feel worse, they start to feel worse before they feel better, and just managing these symptoms, something like that can be so important as a complementary treatment, honestly, because it's
Yeah.
like, what's one thing that I can do? I just lay here literally. I've done it. It's so amazingly relaxing. I mean, if I can just lay, no distraction, zone out. I mean, get into a meditative state. I mean, that's really where your body heals. And that
Right.
modality is just so amazing for people to be able to do that. So I think it's
Yeah.
something that you would want to add into all the things that you're doing just to try to help yourself feel better day to day, honestly,
Right. Yeah.
And then the last question I wanted to ask was, are any of you familiar with any frequency type therapies? Like, I'm seeing a lot of places that are doing I guess I'll put it in the realm of energy medicine. They're using vibrational type of therapies, or frequency with not only light, but anything that you guys have come across that would fall into that category.
Yeah, I'd say we do a lot with frequency. Been doing it forever now, based on whether or not we're testing the frequencies of their signals of the various pathogens, which we can test to see does the body resonating with that. That can give us some information. But also even radio frequencies and the like that you can use to, if you have the right resonant frequency, uh, you can actually remember the old opera singer commercials. I think it was Memorex, right? Where they would have
Oh,
like
they would
the
shatter the
glass
glass.
and they shatter the glass when you hit that right tune.
Yep.
You can do that with radio frequencies and you can actually shatter bacteria and viruses. And yes, people will hurt with that. So there are radio frequency treatments, but even energy itself, like homeopathics, right? Those are frequencies or energy signals to the body. That's kind of where everything really is at. We were just talking before, right, about the Diana with her the light frequencies. So everything's really at the frequency level. Everything's energy and vibration. Our cells are responsive to frequencies. They're responsive to frequencies of light, frequencies of sound, et cetera, et cetera. So that's really where medicine is. That's where it should be. We're talking. We're just wondering, like, why are they not even talking about like what to eat and about Lyme, but my God, they're so far behind medicine is in actual understanding of our bodies, and then we're not these little just cells and components that are like factories. I mean, we are very complex, and everything. I think Tesla said, if you want to understand the secrets of the universe, think of energy, frequency, and vibration. So a whole other discussion for another time.
Oh, for
Mhm.
sure. Actually, in July.
Yep.
There you go.
Yeah, that'll be our topic in July for sure. Yeah, I think it's also that medicine looks at the body, it compartmentalizes it, right? Like now it's come to everybody's a specialty on one organ system, and they don't know anything. They don't even look at how does that affect the entire body, which is you have to look at it as an entire system,
Yeah.
not as one little section that I'll
What
just
when
treat this area.
Yeah, well, years ago, I'm one of the I guess one of the leaders, I'd say, in the field of sort of eyelads, Bernie Raxel, and I was talking with him, and I said, Lyme disease, I said, is the litmus test for the allopathic medical model because it just is not equipped to deal with it,
No, it's
right?
not.
It's like, what do you deal with something that affects everything in every specialty? It's like that's why no one sees it because
Hmm.
they're all looking at their little spot. Like your patient with seizures, they're just looking at the brain.
Hmm.
They're looking anywhere else. It's like
Very
ridiculous.
frustrating. And I try and explain it's one body.
Hmm.
The head is connected to the rest of the body. We're
Yeah.
not decompartmentalized like medicine likes to make us think. It's just one body. Whatever happens in the right arm is going to affect the left arm.
Yeah.
It's just how it is.
Yeah.
Yeah, I'm completely with you.
Awesome. Well, this has been a fantastic discussion. Um, Thank you all for joining us, and thank you, Dr. Pam, Dr. Adam, and Jackie, for being on the call today as our expert panel. So we'll send the recording out early next week, most likely. It'll have the panel's contact information in there, so you'll be able to, if you didn't catch it in the chat, we'll have it in the email, so you'll have access to contacting each of them if you'd like to do that. And thanks for everybody for joining. And again, thank you guys for all of your amazing information. This was a great discussion. And I think we all learned, as we always do, more interesting stuff for sure. So thanks everybody for being on.
Thank
Thank you so
you.
much for having
Thanks so
us.
much. Thank you
Thank
so
you.
much. Take care.
All right, everybody have a great
Bye.
day.
Nice to meet everybody.
Bye-bye.
Bye.
Thanks, everybody.
Nice to
Great
meet you.
subject.
Thank you.